All right. Good afternoon, everyone. Thank you so much for joining us. So today we have Madeline Drexler with us. She recently wrote a book called The People's Pandemic: How the Himalayan Kingdom of Bhutan staged a world-class response to COVID-19. So we've heard so many bad stories, I guess, about the response to COVID-19. So, it's a breath of fresh air to have Madeline with us today to talk about the response that Bhutan gave and all the work she has done in the country in reporting the response they had to the pandemic. So thank you so much for being with us, and I'll pass to you.
Thanks, Marcia. Thank you for inviting me to tell this good news story. Yeah, it's true. Bhutan staged this amazing response to COVID-19, and I'd like to tell you a little bit about how they did it. So far, they've only had 21 deaths in the entire country from COVID. And you might assume that this is because Bhutan is small and isolated, but my research for this book told a very different story. I've been reporting from Bhutan since 2012, and recently, as Marcia mentioned, I wrote this book for the World Health Organization. It's a narrative book. It came out in September. It's called The People's Pandemic: How the Himalayan Kingdom of Bhutan Staged a World-Class Response to COVID-19. And I called it the People's Pandemic for a couple reasons. First of all, it was a true whole-of-nation response, which, as all of you know, was really rare during this crisis. And second, this response was led by the king, who's known there as the People's King. His name is Jigme Kesar Namgyal Wangchuk. But I'll just call him the king in this talk. Anyway, I'd like to share what I learned. There may be bigger public health lessons from Bhutan's success, but at least there may be some food for thought. First, some background on Bhutan. It's a tiny country in the Himalayas. It's wedged between India and China. It's about half the size of Indiana, but it has some of the highest peaks in the whole world. In 2020, Bhutan's GDP was $2.3 billion, which is equivalent to that of just a pint-sized American city. And many of you may know about Bhutan because of its policy of gross national happiness, which is about environmental conservation, cultural preservation, thoughtful economic development. But Bhutan is not a Shangri-La. It has a lot of problems of late. In fact, a lot of problems that were repercussions of the pandemic. And so at the moment, I'm not even sure I would call it a happy country, but it did chart a unique course during the pandemic. So this response was led by a very engaged monarch, but just as important, it was carried out by political leaders who happened to be public health professionals. And actually, I would say political progressives. They included Prime Minister, Dr. Lote Tsering, who's a urologist and a surgeon, the Minister of Foreign Affairs, Dr. Tandi Georgi, is a pediatrician. The Minister of Health is this data-driven dynamo named Dichin Wangmo. She's a global health consultant. She got her MPH from Yale. And from the start, this trio of leaders was highly attuned to public health principles. And then beyond that, the campaign was supported all across Bhutanese society, and it was guided by spiritual principles that would never appear in a public health textbook. when I spoke with her, Dechen Wangmo distilled Bhutan's efforts down to what she called science, solidarity, and leadership from the heart. So let me take you back to the start of the crisis. On January 24th, 2020, as the outbreak was growing exponentially in China, The Lancet published an article that was based on early clinical reports. And it estimated that the proportion of people, it estimated the proportion of people who were infected with COVID who would die. And the estimate was about 3%, which of course that figure was revised many times. Bhutan's king read the article and he asked the health minister to model potential morbidity and mortality for Bhutan. And her projection was about 42,000 cases, about 1,400 hospitalizations, and 20 to 30 deaths. And according to what the health minister told me, the king told her, I cannot, this is a quote, I cannot have that in my country. I can't lose a single Bhutanese to this disease. It will break the nation. So you can't really talk about Bhutan's response without talking about the king. He was 40 years old when the pandemic struck. He's Oxford educated, very erudite by nature, and he's deeply loved by the Bhutanese. It's a worship that I think would feel very alien to Westerners. And as the science was shifting around the virus early on, he read the scientific literature. He kept abreast of every development. He threw very tough questions to the government leaders, and he actually became very well-versed in epidemiology. This king was constantly out in the field. During the first year and a half of the pandemic, he spent nearly 80% of his time, that's 80% of his time away from his home. He was overseeing preparations, he was gathering feedback, he was pointing out weak spots in the defenses, he was motivating frontliners, encouraging villagers. He traveled by car, he traveled on foot, he traveled on horseback, and often to really remote parts of the country. And then whenever he returned to Thimphu, he would quarantine, modeling good pandemic behavior. So from the start, this king articulated the ideas that would frame the country's response. And the main precepts were: strive to prevent any deaths from COVID-19, prioritize lives over livelihoods, plan for the worst case scenario, over-prepare, don't under-prepare, and don't worry about the money. So I want to put these precepts into context. This zero mortality goal, it derives directly from Buddhism, which is Bhutan's official religion and is practiced by more than 75% of the population. The Bhutanese consider a human life precious because they believe in rebirth and the idea that attaining a human life is very difficult, so that if you have a human life, you actually have a chance to improve your future rebirth. So in the early days of the pandemic, when many nations, were trying to strike a balance between protecting public health and protecting the economy, Bhutan didn't entertain that trade-off. It was life over livelihood. You saw that mantra everywhere, including in the news media. Now, Bhutan also has this densely woven social fabric. If there's work to be done, they share it. And it's a kind of 2 degrees of separation society. Everyone knows everyone else, almost literally. when there's tragedy, they grieve together. And really, with each of the COVID deaths, you had the feeling that the whole nation was mourning. There was one policy that really astonished me, and I think says a lot about Bhutan. During the pandemic, the government published online on the Ministry of Health website the personal mobile phone numbers of every team leader in the medical and public health response. And in part, that executive order was meant to ensure accountability, but it was also meant to make sure that people felt cared for. So in practice, it meant that all of the civil service frontliners barely slept because they were constantly fielding messages on WhatsApp and WeChat and Telegram and Viber and Messenger and all these other platforms. So, for example, when a farmer in the Far East, called in to ask if it was safe to milk his neighbor's cow because the neighbor had tested positive for COVID and was in isolation, he got an immediate answer. One woman I interviewed was very angered by a breach in quarantine protocols. And she sent a text message and a WhatsApp message to the prime minister at 11 o'clock one night. And 15 minutes later, the prime minister returned her message, and he acknowledged that there were breaches in protocol and that he would launch an investigation. Of course, the health minister got tons of calls. She was probably the most inconvenienced by this policy, although she's the one who set the policy. And I asked her why she set this phone policy, and she said to me, she said, here's a quote. She said, "It's an emotional connection to your leadership. We can give a hotline number, but who is the hotline number? You can't put a face to that number. We entertain these calls because that's the connection we don't want to lose, the human connection." So I want to tell you about the logistics of this response and what Bhutan was up against. When COVID-19 erupted at the beginning of 2020, Bhutan had only 336 physicians for a population of around 760,000. So that's less than half of the WHO recommended ratio of doctors to people. It had only 1,300 nurses. There were no infectious disease specialists, no virologists, no immunologists. Only one physician in the entire country was trained in ICU critical care. And this small group of health professionals was spread out over 51 hospitals and 184 primary health centers. So everyone knew that if cases were to soar, the health system would collapse. So prevention and preparedness were key. But luckily, Bhutan had been cultivating this preparedness mindset for years. It had a plan for H1N1 flu pandemic. The Royal Center for Disease Control had been conducting surveillance for influenza-like illnesses for years. In 2018 and 2019, the Royal Center for Disease Control had actually upgraded its lab to BSL-3, luckily. Bhutan had these medical camp kits, which are like pop-up hospitals that are used in disaster zones. For example, the 2015 earthquake in Nepal. And as the pandemic intensified, these kits were repurposed as standalone flu clinics. And in fact, many of the first cases in the country were discovered in these standalone clinics. One of the most prescient pieces of preparation took place at Paro International Airport, which is the main gateway in Bhutan. It happened in early November 2019. So it was just 1 month before everything started exploding in China. WHO led this simulation exercise, and the scenario of the exercise was that a passenger arriving from Thailand was infected with a dangerous new strain of coronavirus. And then when the real virus started spreading, that exercise was still vivid in people's minds. On the very earliest days of the pandemic, right after the initial WHO announcement on the last day of 2019, Bhutan was really fast off the mark. In mid-January, it began screening passengers, airline passengers, for respiratory symptoms, and it was doing infrared scanning for fever. And then by early February, the whole country was plastered with posters about how to prevent infection. Bhutan had just a handful of public health epidemiologists. So to fill the gap, the health ministry enlisted professionals from animal health and food safety domains. And this was possible because Bhutan was firmly grounded in the One Health movement, which, as you know, recognizes that most new and emerging human infections come from animals. So when COVID-19 broke out, Bhutan's One Health colleagues, both from the public health and the animal areas, mobilized their resources together. Basically, it meant that the public health people could borrow PPE and PCR machines from the animal health people. Bhutan also convened this COVID-19 media team that communicated daily with people via press briefings and news releases, social media. They debunked rumors and misinformation, which are always rife on Bhutanese social media. I should add that Bhutan is a highly social culture, and every aspect of life was curtailed in one way or another early on in this pandemic. By late March, people were required to maintain physical distance in public places. Schools and institutions were closed. Gatherings for religious purposes were discouraged. Social events like birthday parties and wedding celebrations were not allowed. Movie theaters were closed. Sports were banned. Bhutan was by far the most restrictive country in this region in terms of travel. Starting on March 16th, which was 10 days after the first case was announced in the country, March 16th, 2020. All those who entered Bhutan were sent to these designated facilities where they would be quarantined for 2 weeks. They were mostly hotels. In other nations, as you know, COVID-19 patients who were not seriously ill were told to isolate at home. But in Bhutan, anyone who tested positive was cared for in a hospital, whether or not they were symptomatic. In late March, the government decided to exceed WHO quarantine guidance by extending the quarantine period from 2 weeks to 3 weeks. And that was because the literature was starting to show that even after 21, 23, 28 days of quarantine, sometimes people tested positive. And the Bhutanese officials felt that if they had enforced the 14-day quarantine, one case in every 100 people would have been missed. And if just a couple of leaks had happened in that population, it would have led to uncontrolled spread of the virus and really the breakdown of the health system. So officials there understood from the start that without extensive testing, the real reach of the virus would be unknown. So the health ministry launched this testing regimen so that it was so sweeping that by the spring of 2020, Bhutan actually had one of the highest per capita testing rates in the world. and all individuals who were considered high risk were given PCR tests. Bhutan also instituted these strong infection control measures so that medical facilities did not become hubs of infection. Outpatient and inpatient departments deployed these teams of doctors and nurses, X-ray technicians, sweepers. They were completely self-contained units. They never mixed with others in the hospital population. And then also when they left work, they were sent to designated hotels during their deployment. So basically they were totally self-contained units. And really, to Bhutan's credit, it wasn't until 18 months into the pandemic that the first health worker became infected there. I should also add that Bhutan is highly committed to primary health care. And during the pandemic, it did not interrupt routine services like emergency care or immunizations, dialysis, chemotherapy, things like that. And actually, in the middle of the pandemic, the country achieved 95% nationwide coverage of its first dose of HPV vaccine. Now, Bhutan has a reputation of being geographically isolated, but it shares a 699-kilometer border with India. And this southern border was very porous. Before the pandemic, in effect, there was no border. People walked across all the time. India, of course, was a hotspot. And so the southern border was really Bhutan's Achilles heel. And their big worry was, how would they detect cases quickly? So on March 23rd, 2020, Bhutan sealed all of its land borders. People and vehicles were not permitted to travel across the border to enter Bhutan, except when they were authorized. And then on top of that, the goods that were brought in through the main southern import point were handled with elaborate safeguards. So naturally, all these measures took a huge economic toll on people. And to ease the worries of tens of thousands of people who were left jobless, the king in April 2020 launched a relief fund that provided monthly subsistence income for people who had lost their jobs or their means of earning a living. And also interest was waived on loans. And that program actually lasted through June 2022. Now, even with all these public health precautions, Bhutan did see waves of transmission, and it did have lockdowns. The first national lockdown was in August 2020. And during those 3 weeks, a large corps of civil servants and volunteers delivered food and other essentials to every household in the country. Special orders for tobacco and alcohol were also delivered, just enough to keep people who were chemically dependent, to help them get by without suffering and without wanting to breach lockdown rules and in order to get whatever they needed. So it was a classic harm reduction approach. A second national lockdown took place in December 2020 to January 2021, when Delta started spreading. Bhutan did not see its first death until January 2021, so it was a full year into the pandemic. And then a third national lockdown took place in early 2022 when Omicron blew up. So with Omicron, it became clear that while the variant was highly contagious, it was more mild. So in March of last year, the Prime Minister announced that barring extenuating circumstances, the era of lockdowns in Bhutan would soon end. Once children were fully vaccinated, they were that far along in their vaccination campaign. Once children were fully vaccinated, life would return to just about normal. And that's actually what happened. I was in Bhutan this past fall, and basically I did not wear a mask the entire time. I want to briefly tell you about Bhutan's incredible vaccination campaign. It was a rebuke to places where anti-vax sentiments proliferated. In Bhutan, barely 1% of the population said that they would not take the vaccine. But still, the Ministry of Health was really canny in how it carried out vaccination. So this is a devout Buddhist culture, and the ministry honored that and launched the vaccination effort on the most favorable date possible, according to the Buddhist astrological calendar. So it was on the auspicious day of March 27th, 2021, at the auspicious hour of 9:30 a.m., that the first dose of the vaccine was delivered to a 30-year-old woman who was born in 1992, which is the auspicious year of the monkey. But then after that, there was this national dosing blitz. By April 9th, Bhutan had immunized 94% of those who were eligible. I don't have to tell you how far that figure outstripped what happened in the US or the UK, which had been conducting vaccination campaign for months. Bhutan's first vaccine rollout in the spring of 2021 took 13 days. The second campaign, the booster dose, which took place during the monsoon months of the summer, took just 1 week. But this too, this success has a long backstory. In 1979, the country established its expanded program on immunization with the objective of reducing common vaccine preventable infections like TB and diphtheria, pertussis, measles, Hep B, things like that. And since 1991, Bhutan has maintained childhood vaccination coverage of more than 95%. So these previous campaigns planted trust in the idea of immunization, and they also paved the way operationally for COVID-19 vaccine rollouts. Bhutan got its first doses of the vaccine, it was the AstraZeneca brand from India. But when India was overwhelmed by the Delta variant, Bhutan really had to scramble to get its second doses. It's a dramatic story. I devote a whole chapter to it. Ultimately, they were able to get the Moderna vaccine through COVAX from the US. So their vaccination program was a mix and match regimen. The vaccination campaigns reached everybody. Health workers tracked down yak herders. They were waiting for hermits to leave their caves after long periods of meditation in order to get immunized. They reached people in the most remote jungles in the south and just really the most brutal conditions in the north. I've been a journalist for 45 years, and some of the most inspiring interviews I've ever done were with members of the team who were vaccinating people in Lunana, which is in the far north. They had to travel across these dangerous Himalayan passes in order to reach these far-flung villages. And they traveled at night. They traveled at night in order to reach the villages. And then on the very last day of their assignment, when they thought they would be able to breathe easy, they were coming down a mountain pass and encountered just a sudden blizzard, and they nearly died in that blizzard. It's an amazing story. So public health experts use this term all of society or whole of nation to describe a countrywide pursuit of a common goal. I have to say that in Bhutan, everyone was on board. For example, there are these men and women in these very striking orange uniforms, everywhere during the pandemic. These are where the Zanka word is desoups, the so-called guardians of peace. They're members of a volunteer corps that the king founded in 2011 for disaster relief operations. But during the pandemic, they built temporary living quarters for Bhutanese who were relocated from India. They prepared rooms and served meals in quarantine facilities. They loaded and unloaded essential goods. They patrolled the streets in Thimphu and other places for breaches in safety protocols. They screened travelers at points of entry. And these soups range across all of Bhutanese society. So they're members of the royal family, they're parliamentarians, they're teachers, they're civil servants, they're homemakers, they're former monks and nuns, they're unemployed youth. It's truly a fair demographic representation of the whole country. I should also add that in a country where 3/4 of the population is Buddhist, the central monastic body played a really important role. A few months into the pandemic, the chief abbot led the first ever initiation or empowerment, as called, of the medicine Buddha ritual over TV and social media platforms. In Vajrayana Buddhism or Tibetan Buddhism, the medicine Buddha meditation is considered the most powerful for healing and for dispelling illnesses. And before the ceremony started, the chief abbot said, this is a quote, "Putting in practice the instructions given by the Ministry of Health is absolutely essential." He also told the listeners that the Buddha himself, even though he had already achieved omniscience, listened to his doctors. So in February 2022, The Lancet published a study that you may have seen that I think sheds light on Bhutan's all of society response. The authors looked at 177 countries. They did not include Bhutan. Anyway, and examined which conditions correlated with rates of COVID-19 infections and with the proportion of infections that led to deaths. And of course, the project was inspired by the fact that what had been standard metrics for pandemic preparedness, like health system capacity or government health expenditures, didn't hold up when COVID-19 struck, in part because the metrics failed to account for poor leadership or dysfunctional political environments. We all know that story. And in the study, two of the strongest indicators of pandemic preparedness, as gauged by infection rates, were trust in government and interpersonal trust. And these factors were also tied to higher vaccination coverage. So during the pandemic, trust in government and especially interpersonal trust were off the charts in Bhutan. So I guess the question is, how could Bhutan's approach be adopted or at least adapted by other nations? Here I want to quote Azov Bitan. Many of you know him. He's executive director of Ariadne Labs, which is a center for health systems innovation right here in Boston. Azov believes that lessons can be learned from Bhutan. And as he put it, here's a quote. He said, I don't think that countries offer blueprints. They offer directions, questions, new approaches that can often inspire interesting, contextually bound interventions in a different place. It's less about a recipe and more about a compass. So Azov told me he was struck by several aspects of Bhutan's response. And I'll quote him at length again, because he's much more eloquent than I am. He said, number one, you don't have to be a giant authoritarian state with an almost panopticon command and control approach to COVID to minimize morbidity and mortality, nor do you literally have to be an island in the middle of the Pacific. Second, the lack of politicization and the pragmatic, thoughtful, continually learning approach in Bhutan, trying something, doing it again, iterating. These are quality improvement principles. Azaf told me he was most impressed by Bhutan's uncompromising attitude to protecting its people. Again, here's a long quote from our conversation. And please note that he and I spoke about a year ago when the whole sort of profile of the pandemic was very different than it is today. We were still really in the teeth of the virus back then. He said, Bhutan is an important counterexample to the narrative that has washed by much of the US, which is that COVID is the new reality and we should just expect to live with a few hundred deaths a day in the good part of the year and a few thousand deaths a day in the bad part of the year. In the US, we had an inability to imagine the unimaginable, and then a concomitant and strange ability to become okay with it. We had to accept 300,000 or 400,000 deaths a year, as if that's acceptable. What's the point of a $3.5 trillion healthcare investment if we have to accept the unacceptable? We should be ashamed of what happened here. There was no shared mental and social model, no shared understanding of what we were facing. And he added again a quote, you can't replicate Bhutan's tactics. It's not that we should have this Pollyannish view that that's what we need to do in the US and other places. But Bhutan's example should make us look in the mirror. Look what happens when you privilege every life, when you care, when you do not accept the unacceptable, and you instead imagine the unimaginable. In the US, we had enough money to stage a much more effective response, but we didn't have enough political and social cohesion, and we didn't have enough heart. My own perspective is that Bhutan it's not a model nation. It's not the world's most happy country. It has plenty of problems and complications, and it's now suffering the economic effects of the pandemic. But in terms of its public health response, I think it's a unique success story. And if you want to read the whole story, it's in the narrative book that I wrote for WHO. This is advertising. It's called The People's Pandemic. You can access it on the WHO website. And I think the PDF link is in the email announcement for this talk. So anyway, thank you for hearing me out. I'd be happy to hear what you have to say and to the best of my ability, answer any questions. Thank you.
Thank you so much for sharing this really, really incredible story about Bhutan. So I see that Dan has a question. Let me ask one question and then I'll pass it on to Dan. So you mentioned two things that I'm a bit curious. One is that they never interrupted primary care. So if you could say a little bit more about this, and if you could say if the health system ever collapsed, because quarantine, if I understood correctly, was always in the hospital. So if you could say a little bit about those, I would appreciate it.
Quarantine was not in the hospital. Isolation was in the hospital.
Isolation, okay.
Yeah, and they had few enough positive cases because of their, exorbitant precautions that they're actually, the hospitals were able to care for those COVID positive patients. There were a few times, I believe it was I think it was in December 2020 when things were pretty hairy, but they were able to get through it. Marcy, you know this, they have an amazing primary healthcare mentality. And so these basic health units, which are everywhere in the country, they deliver primary care very effectively. It's just really part of the mindset of healthcare practitioners there. And so, yes, I mean, I don't think it was with any undue stress that they were able to continue their immunization programs and other surveillance programs. I had not heard about that. And I forgot the other part of your question.
I think you answer if the hospital system ever collapsed.
It never collapsed. In fact,
Never
it
collapsed.
was never really near collapse.
Okay. All right. Dan.
Well, can I mention one more thing?
Absolutely.
Which may help explain why it did not collapse. I didn't include this in my talk, although I thought it was really interesting. They conceived this way of caring for patients, which they termed clustered case management. And really, there were only 4 hospitals that cared for COVID-19 patients. It was the National Referral Hospital in the capital, and then the 3 regional referral hospitals. No others cared. So the idea was that if every hospital had cared, every hospital in the country, all 51 had cared for COVID patients, there would have quickly been burnout among the healthcare personnel, and they would have run out of supplies. So they concentrated all COVID cases in these 4 hospitals, and I think that may be a big part of the reason why the health system didn't collapse.
Okay, got it. Dan.
So I have 3 questions. I'll just state them rapidly. First one is, you said things have changed. You don't think things are so great now. And of course, I'm sure I'm not the only one who is waiting to hear that part of the story. Second thing, I wonder, was there a misinformation, disinformation problem, and how was that handled? And the third thing is, if I'm listening to your wonderful, instructive story, I wonder, is this a fair way of drawing a lesson, which is, if you've got trust to begin with, you'll come out all right, and if you don't, you're sunk?
This is how I look at it. I mean, there are several questions there, and I hope I can get to all of them. You wanted me, I think, to talk about how things are difficult now as a result of the pandemic. It's true that, mask wearing and a lot of the really onerous parts of the pandemic response are no longer necessary, but definitely people are suffering there. It had a huge economic impact on the country. This lives over livelihoods. I think at the time, and I think even now, people were very grateful for that kind of promise from the king and from the political leaders. But tourism is the second biggest source of income for the country behind hydropower. The tourism industry was decimated. I mean, I think literally decimated, like down 90%, something like that. And a lot of people were just left out of work. So, and in fact, there's at the moment a great exodus from Bhutan to other places. So, that is something that the political leaders are going to have to grapple with, and they are in various ways. Misinformation, disinformation, there was a lot of it. It's absolutely true on social media. I mean, Bhutan, it may be a gross national happiness country, so-called, but social media is always rife with rumors, and it really did play out a lot to the point during the pandemic where people were posting on social media. What am I say? Facsimiles of government announcements with completely wrong information, just for fun. And yes, they were able to quash that through their own website, through I think that, as I recall, Facebook pages and BBS, Bhutan Broadcasting System announcements. The health minister appeared every day, every evening, I think, and addressed all these things very quickly. So, yes, I mean, there as well as here, there was just a lot of misinformation, particularly around vaccines, I should say. Particularly when these side effects were starting to be revealed with the AstraZeneca vaccine. Trust in government. Are you asking me if trust in government is sort of a panacea during pandemics?
Prerequisite.
Prerequisite.
Yeah.
It's hard to separate Bhutan's, or I should say among the Bhutanese, their trust in government from their reverence for the king. I think as they saw it, and as they really see every major policy decision, it's the king who's behind it. And I can't even begin to describe their reverence for their monarch. It is something that is incomprehensible to our mindset, but it's real. And they felt that the king was personally and completely behind the Bhutan pandemic response effort, that it was a reflection of his caring for the people. I think they also, in large measure, trusted the government, but the king will always be number one in their hearts in terms of trust.
It was particularly this king, or this has been
This
happening?
king, I think that this has always been true of the Bhutanese. It's an aspect of their culture that requires a lot of explanation. But this king in particular is quite popular. He's young. He became king in his father actually left the role and gave it to his son. His son was in his 20s. He was very handsome. He was very popular. He became king in 2000. I think it was in 2007 or 8. And he was always, from the start, a very, very popular king who made it a point of going out and meeting people. He has sort of long Elvis Presley kind of sideburns, and he is kind of a dashing person. But I also have to say, from all the interviews I did, and I wish I could have interviewed him, but I never got a chance, of course. He was very shrewd during this pandemic, and also very compassionate. I mean, there's a story in the book about he gave a second national address on April 10th, 2020, and he was talking to the nation, basically trying to rouse people, to get them to rise to the occasion, to give everything they had, as he promised that he would give everything. And there was a point near the end of his talk where he lost composure. And this was live TV. He, when you lose composure for 20 seconds on live TV, that's like an eternity. And then he regained composure and then quickly finished the speech. But to the Bhutanese, that was just it was just one of their most emotional experiences of their lives with this king. They all talked about it. It was like the topic of conversation for weeks and weeks and weeks. That's their reverence for this person.
Okay. Nancy.
Yeah. Hello, thank you for a very interesting talk. So actually, I'm a Takimi fellow from Hong Kong, and my epidemiologist working on COVID. So from the things that you described, it looks very similar to the policy that mainland China has adopted. And it seems that there are different response. I mean, like the way, the perception on the same policy being done by Bhutan and in mainland China. So what do you think, like, can you comment on the similarity and differences between the perceptions and response between Bhutan and China? And second question is that, like you mentioned, Bhutan also have one of the highest rate of mass testing of COVID in the populations. And at one point that we know that actually that same policy suck up many of the GDP allocated to the health systems in mainland China. So in a way they also mentioned there's no collapse of the health system in Bhutan. So how can it be done, or we are just waiting for a delay effect of that, like economical cost of such a high detection rate, like high mass testing? Over.
I'm going to ask you again about, I'm not sure I understand the second question, but I'll tell you a little bit about the similarities and differences to China, mainland China's policy. You're right. I mean, early on, both policies of both nations could be considered almost draconian, really. I see, and I'm not as familiar with China's policy, but I can tell you one thing, really based on recent news events. Well, a couple of things. First of all, Bhutan was very astute about delivering all of the aid, both medical, food, all essential supplies to people. It had gamed that out at the very beginning of the pandemic. It was able to provide people what they needed when they needed it. It wasn't an absolutely perfect rollout, at least in the first lockdown, but it was good. And in the second and third lockdowns, it was really quite good. So people, they did not feel abandoned. Also in the unlocking policy, I mean, there was discussion for months in the Ministry of Health about actually how they would unlock Bhutan after, the worst of the pandemic had passed. And their unlocking, unlike China's, which was abrupt, and I'm sure you've all read the estimates of upwards of 1 million deaths. In Bhutan, it was a very, very slow unlocking, so that they were looking at infection rates, it was and looking at other things, so that they wanted to make sure there would never be a surge in the unlocking phase. I believe it was a 4 or 6 week slow unlocking until they felt that everything was in place, that everyone who possibly could be vaccinated was vaccinated. And really, this was the Omicron variant, but by the time they had unlocked, there was never, the health system was never imperiled in any way. In fact, there wasn't even a great surge of cases. The second question, I'm not sure I understood. I can say about, in terms of testing, where they got their test. I have a chapter about their very initial responses when the pandemic broke out in January 2020. This health minister really bore down on everyone and made sure that wherever they could, they got PCR tests. They scored a lot of PCR tests that, that if they hadn't received those tests and somehow gotten them in that first month, they may never have been able to do the testing that they did.
Yeah. So my question is more like, so China also spent a lot of resources in mass testing and health code requiring people to do testing, like in order to go to work, these sort of things. And the testing itself cost money. And so China has a very large population, of course. And so just maintaining the mass testing has cost a lot and have an economical impact on the money that you can, which can be alternative allocated to the health systems. So wouldn't the same situation apply to Bhutan as well, that you put the money in doing the mass testing and then suck up money from other existing infrastructure?
I wasn't aware of that. That wasn't what my reporting came up with. And it's not as if the Bhutan health system was was wealthy by any means. It's a very rudimentary health system, based on primary care, which is not itself all that expensive. I believe that times during this Bhutan pandemic response, the king gave basically royal monies to underwrite this effort, and that may have been a cushion that you're talking about. But it's not as if Bhutan has an exorbitant healthcare system to begin with.
Richard.
Yes, just a couple of comments. First of all, regarding China. Problem with China is that they didn't immunize during that period when they had crushed the so-called attempted to crush the epidemic. Unlike Bhutan, which did immunize its population. That's the great difference between the two of them. China squandered its advantage. I
And
think
it was a
there are-
lousy vaccine on top of it.
well, then, yeah, but it was still preventing deaths. It was the vaccine that still prevented deaths, although it didn't prevent as many infections, but they squandered their advantage. I think that it's a very interesting discussion, and thank you very much. I think that, as you pointed out, trust was very important. When I was in Bhutan many years ago, it was very clear that the monarchy was highly supported by the people and they of them. They also had achieved great immunization coverage prior to this, as you pointed out. And I think that's really important. So there was a history of, and thirdly, like Kerala and like other states, they had a very strong social support network. And I think that's really critical, because if you're going to ask people to inconvenience themselves, you've got to support them in terms of food, health services, and so on. I think another very important point that you made was that this did not depend on a lot of doctors. We were the most medicalized of all societies, and yet we had a very high case fatality rate compared to many countries that in sub-Saharan Africa, for example, had very, very low health care to population ratio. This was not a pandemic that depended upon health providers, though they did rather heroic things. That is not what saved lives. What saved lives was preventing the illness to begin with, not all of the bells and whistles and other technologies that we began to think was really what was causing the deaths to go down. No, that wasn't it. So I think there are a lot of very, very, in fact, all of Asia, many of the other countries, South Korea, Japan, Taiwan, and so on, followed a playbook that was not dissimilar from what Bhutan had achieved. So thank you very much for a very fascinating discussion.
Thanks, Richard.
All right. On that note, I just want to tell everybody that Dan put a link in the chat, which is the link to the book. The PDF was included in the invitation. So I encourage everybody to take a look and read about this really, truly incredible story. And I want to thank you, Madeline, for joining us, sharing the story. You know, once in a while, it's good to hear good stories instead of failures. So thank you so much. Much appreciated. Thanks, everyone. Hope to see you next week in our next brown bag. Thank you.
Thank you.